Hello, my name is Lachlan, and today I'll be discussing some findings in regard to biomarkers for identifying eating disorders by using machine learning and MRI neuroimaging. It should be noted that this method is still in the early stages of investigation and that these findings are preliminary. The impact of that will be discussed in due course as we explore this topic further. Eating disorders are psychiatric conditions that generally have their onset within adolescence. These disorders cause disturbances in dietary intake through either over or under eating. Females are more likely to experience eating disorders, and as such, this study utilized only female participants. For a diagnosis of anorexia, three main criteria must be met: significantly low body weight due to persistent reduction in energy intake, fear of weight gain or being fat despite being underweight, and disturbances in the experience of one's body shape and weight. This can be in the form of influence of self-evaluation or a denial of the seriousness of the condition physiologically. Bulimia nervosa is characterized by frequent binge eating episodes followed by compensatory behaviors on a weekly basis. Previous neurological literature within this area has found notable differences between patients with eating disorders and healthy controls. For anorexia, differences found were lower volumes of grey and white matter globally, reduced cortical thickness, and widespread brain abnormalities in the regions shown on the slide. For bulimia, differences found were in the involvement of the neural reward system, as the regions in the slide denote. It has also been noted that the regions mentioned here show high activation in addicts. Similarly, during binges, a theme of increased tolerance has been noted, much like addicts, whereby more food is required in order to achieve the same satisfaction each time the behavior is engaged in. This can in turn increase the length of engagement in compensatory behaviors. Currently, there is a strong reliance on the clinical interview techniques, coupled with physical and behavioral examinations for the diagnosis and monitoring of eating disorders. Difficulties with this approach are that the clinical aspects of ED can be quite fluid. For example, weight normalization may be noted in some patients, or a switch from anorexia to bulimia. Considering both subtypes present differently, this can be difficult for clinicians to keep track of. Previous studies have shown that machine learning methods can extract biomarkers for other psychiatric disorders, so why not for eating disorders? This study aimed to reliably identify biomarkers within patients with eating disorders when compared to healthy controls using MRI neuroimaging, principal components analysis, support vector machine classification, and voxel-based pattern distribution. The authors of this study did not explicitly state any hypotheses, however the implication is that machine learning methods could be utilized to reliably extract biomarkers to identify patients with eating disorders, distinguishing them from healthy controls. 103 patients presenting with ED were screened for participation in this study. Inclusion criteria and exclusion criteria were as noted on the slide. Following this screening process, 17 eligible females with ED were recruited. 17 healthy control participants were also recruited for comparison. All were female without history of neurological or psychiatric disease, with a normal range on the Minnesota Multiphasic Personality Inventory. All participants underwent psychiatric self-report battery, and the full list of this can be found in the article itself. MRI acquisition overseen by expert physicians and neuroradiologists was also done, with image pre-processing conducted as per the steps on the slide. Feature extraction was achieved through the use of PCA. Orthogonal transformation of the dataset allowed ordered by variance, and then it was projected into the PCA subspace, which decreased features to be handled and gave PCA coefficients, which were then ordered using the Fisher discriminative ratio. Support vector machine classification was done using the BioLearning tool in MATLAB. ED versus HC extracted PCA coefficients, and then the labels were later used for classification algorithms. A linear kernel was also used to improve generalization and the use of weights. Voxel-based pattern distribution was mapped for each discrimination group to show structural brain differences. SVMs assigned a weight to show importance on a scale of 0 to 1, and a color scale was superimposed over a stereostatic brain for spatial localization. This in turn facilitated the identification of new MR-related biomarkers for the diagnosis of ED patients. Statistical analysis was done using Statistica, testing normality, and t-tests were also run to determine potential differences in demographic, clinical, and MRI. Significance was determined by two-tailed alpha score of less than 0.05. Clinical data showed that patients with ED compared to their matched HC correspondent did not show global anatomical atrophies in GM or WM volumes. Behaviorally, ED groups displayed the expected psychopathological profile. Higher scores recorded in ED patients for the scales shown in Table 1 on the slide, and no significant differences were found noted in Table 2 on the slide. Machine learning. No images were excluded from analysis in the study due to pre-processing issues. ANOVA for ED versus HC showed PCA variance explained 27% of variance. FDR allows finding features for which discrimination between groups was maximised. Results for accuracy, specificity and sensitivity when using 31 PCA coefficients and 21 PCA coefficients are shown on the slide respectively. It can be seen that performance of the classification algorithm increases with the number of PCA coefficients used. Structural brain differences found through voxel pattern distribution were mainly found in the occipital cortex and posterior cerebellar lobe. Other areas of interest are also noted on the slide in the table. Behavioural features of anorexia remain stable as noted in the table, and additionally the three largest contributors to BN characterization are noted in the same table. Pattern recognition analysis distinguishing eating disorders from healthy controls showed the involvement of the cerebellum, reward-related cortical regions such as the anterior cingulate cortex and orbitofrontal cortex, occipital cortex, and sensory-motor cortex. The cerebellum plays a role in motor, cognitive, and emotional functioning, as well as the regulation of visceral and autonomic regulation. The specific involvement of the cerebellar vermis was noted. This is important for feeding behavior and appetite regulation. The cerebellar vermis also demonstrated GM loss for anorexia, and a dysfunctional neural pattern was related to the psychopathological aspects of eating disorders, such as drive thinness. It is also connected with limbic brain structures as noted in the table on the slide. Related cortical regions, such as the ACC and OFC, are also associated with the ventral limbic circuit in the amygdala, insula, and the ventral striatum. These play a role in identifying emotional significance of appetizing stimuli, for inhibiting impulsive behaviors and regulating reward systems. Alterations of the mesolimbic reward response could shine a light on the lack of control and impulsivity often presented in BN. Evidence for altered reward processing in anorexia was also present, with different perspectives on stimuli shown to be activating the reward-linked regions, such as emaciation, which is typically aversive to healthy control. The occipital cortex has a role in body image disturbance, which is considered a fundamental characteristic of anorexia. Areas within the occipital cortex are noted on the slide. Also noted was the altered affective connectivity between regions in anorexia patients during the viewing of their bodies. The sensory-motor cortex's involvement showed abnormal neural changes in the precuneus and sensory-motor premotor cortices. Higher activation of the premotor cortex noted in anorexia patients when self-other body shape comparison was undertaken when viewing slim models. As noted on the slide, altered grey matter volume was found with respect to ED versus HC in the areas written. Altered neural changes in these areas may also represent the physiological consequence of physical hyperactivity typical of ED patients. It may also represent dysfunction related to the body awareness underpinned by visual perception, proprioception, and touch. The strength of this study are as follows. While previous studies have compared eating disorders to healthy controls at a group level, this study did so on an individual level, which has less of a limiting effect on the clinical application. The study's severe inclusion criteria did limit the potential confounders, such as controlling for BMI with eating disorder to healthy control matched pairs. SVM also boasted high accuracy in brain regions involved in pathophysiological mechanisms of eating disorders, and the classification accuracy was equal to or higher than previous studies as noted on the slide. Methodological limitations were the inclusions of only two extreme subtypes of ED. Whilst these findings are promising, diagnosis of ED is generally complicated by the factors that were controlled for in this study, such as previous psychiatric conditions or comorbidities. This is unfortunate as it means findings cannot be generalized to all ED populations. The small sample size also means future research with larger samples will be necessary to retest the above-mentioned findings. For future research, this study has laid the groundwork to move forward with larger sample sizes, utilizing SVM and machine learning. This study has shown that inferences can be made for monitoring ED progression, improving preventative measures, and better treatment decisions by using SVM. These preliminary findings offer new avenues for neuroimaging approaches in psychiatric conditions. It also alludes to the fact that supervised whole-brain automatic classification methods may become essential for the improvement of clinical management of psychiatric patients. Pathophysiological mechanisms underlying ED still, however, require further research.